Hi guys, and welcome back. In this video, we will be doing a deep dive into the LSS charity bottom-up development case study. This is an essential part of the specification for challenges of an urbanizing world, and I have included exam-style questions to give you an idea of what you could be asked in the exam. I have also done a video on the Vision Mumbai top-down development case study to help with the other side of the debate. I will link it in the description, and it will also be available on the case study playlist. Okay, let's get started. I have divided the case study into four main questions so as to make it easier for us to access it and to remember. And the first one is the why. So why are health charities like SSS needed, especially in places like Mumbai? Then what is LSS? Then the third question we'll be asking ourselves is how. So how are the objectives of LSS implemented within Mumbai? And then lastly, we have the outcome. So what is the outcome? What has been the outcome of having LSS in Mumbai? Has the project been successful or not? Okay, so we will start off with the first one, and that is the why. There are three main reasons why LSS was needed in Mumbai. And the first one is because of poor water quality, poor sanitation, and waste disposal within Mumbai. Now, Mumbai slums pose serious health risks to the residents, obviously. There's a lack of water security. We did say that they use communal taps, and as a result, there's a lack of water security. There's also poor sanitation due to that lack of water. And then there's poor waste disposal, and that poor waste disposal is as a result of having a lot of rubbish or garbage in the area, and also due to poor sewage disposal as well. So that means that diseases are likely to be contracted and will spread very fast within the slums or this particular area, and that is because there are many people living within a small area, which then means that if a disease is contracted by one person, then it's likely to spread through the population fairly quickly. Okay, so on to the second reason why LSS was needed in Mumbai, and that is a medical insurance system in India. Now, what does that mean? Now, India does not have a national health service like the UK does. Now, in the UK, if you want to go to the hospital, in most cases you'll go for free, unless you'll go for free if you're using the NHS, unless you have decided to take private healthcare. So, because India does not have a national health service, it means that you have to pay for treatment. Now, you can either do that by paying directly to the healthcare provider, or you can have insurance. You can pay for insurance, which will then cover you. And when you go to the hospital, the insurance company will pay on your behalf. So that makes it quite inaccessible, as in the the healthcare system is now inaccessible to people who are very poor, because they will not be able to afford, first of all, those insurance premiums, and therefore they are likely not to have medical insurance. So when they get sick, they are likely to struggle in terms of getting treatment for whatever their ailment is. And then in terms of paying directly for it as well, they don't necessarily have the money to do so. So that becomes a problem in Mumbai, because if somebody is sick, then it means that they cannot get the medical attention that they require, because they cannot afford it. So LSS then becomes necessary in Mumbai, because it's a charity that is going to help such people. And then the last reason why LSS was needed in Mumbai is leprosy. Now, leprosy is a slow developing contagious bacterial disease that affects the skin, the nerves, and can cause life-changing body deformities. So it affects the skin, the nerves, and also causes body deformities. And it's quite common in Mumbai slums, unfortunately, but it is treatable and curable. It's only one of many diseases that affect Mumbai. So leprosy is an issue in Mumbai, and therefore, and because it's treatable, then organizations such as LSS will make that treatment available to these people who cannot afford the health insurance that that is in in India. Okay, that is the system of medical care in India. So the charities will help people like those ones access medical care, people with leprosy. Okay, so three main reasons there why LSS was needed. I've included a couple of other examples here of charities that operate in Mumbai. So LSS obviously is not the only charity in Mumbai. So you have examples such as Reliance Foundation, you have Tata Trusts, you have Being Human, and so on. So all these are other charities that help, especially the poorer demographic, which is the people who are the people that live in places like Dharavi, to access the services that they need. Okay, so moving on to the exam style question that we have here, and this one is an 8-mark question. So for a named megacity, assess the challenges faced by the population. So your megacity here is Mumbai, and you're going to talk about the challenges that the population faces. And the population specifically that is facing these challenges here is a population that is living in Dharavi. So the people that live in the slums in Mumbai. And you can discuss each of these. And then after that, weigh them up, say why they are a problem to the population, and then say which one you think is the most important compared to the others. So this information here would be really, really good for answering that particular 8-mark question. So in your own time, you can have a go and practice it and see how you get on. So what is LSS then? So it stands for Lok Seva Sangham, and it is a health charity that has worked in Mumbai since 1976 to control leprosy in a slum on the edge of Dharavi. So they've been there since 1976, and they are trying to control leprosy on the edge of Dharavi. LSS raises its own funds and employs volunteers. Although recently they have also employed some permanent members of staff. But if they are raising funds, then it means that they are relying on people to donate the funds that they need to operate. Right. So LSS is an example of a bottom-up development project. And bottom-up development projects are where experts work with the communities to identify their needs, offer assistance, and let them control their own lives. And we are going to see how LSS does that for the population of Mumbai. So bottom-up strategies are normally run by NGOs such as charities and universities. Now LSS is a charity, so it's an example of an NGO, so a non-governmental organization. It's not affiliated to the government, but they are working independently. And LSS has had 3 targets to reach this goal. So this goal of controlling leprosy in the slum. And the first one is to conduct surveys in the communities to detect skin diseases. So they go into the communities to try and find to investigate and find out who has leprosy, so that they can begin helping them get the treatment that they need. And also, the other thing that I'd like to mention here is that there is a kind of a stigma that is attached to having leprosy, because it's a skin disease, and because of that stigma, a lot of people, and especially if they cannot afford medical care, are likely to not want to be exposed as having the disease, or not to want people to know, and therefore it's as though they are likely not to to be forthcoming about having the disease because they don't have a way of it getting looked at and treated. And therefore, LSS does a very good job because it goes into those communities to find out actually who is suffering from the disease and then give them a way towards treatment and towards getting cured, which is really good. And then the second objective here is running dermatological clinics. Now, we know that dermatology is the study of, it's has to do with the skin. So dermatological clinics here is referring to skin clinics, which can then detect the disease and then start to help people on their way to, get onto the road to recovery. Then thirdly, in terms of objectives, they provide the drugs that are used in the treatment via mobile pharmacies. So these drugs obviously are likely to be free because if you charge people, then they'll not be able to afford them. So this charity is doing a very good job of identifying the people that have leprosy in Mumbai and then getting them the treatment that they need. On to the how. So how does the LSS implement its objectives? So we had talked about 3 objectives and we are going to look at how they implement them here. And one of the ways they implement their objectives is through health related work. And they work very hard to provide better health care in Mumbai slums, focusing on the control of leprosy and tuberculosis. Now, tuberculosis is also referred to as TB, so I will refer to it as TB going forward. And now, if we may go ahead of ourselves a little bit here, LSS has done such a good job with leprosy that the cases of leprosy have reduced by 75%. And because of that, they can now focus on something else or another disease that affects the people within this community. And that disease is TB or tuberculosis. So it's really good to see that their work has made a difference in the slums and that they can now focus on another disease as well other than just leprosy. They run 33 clinics where they detect, treat, and provide drugs for leprosy and TB. Then the second way in which they implement their objectives is through education. And LSS provides free education and access to learning centers to the marginalized in Mumbai, especially the leprosy patients. Their work is called SET, so S-E-T, and S stands for service. So this involves identifying the cases of TB and leprosy. Then they educate people on them, on what the symptoms of the diseases are, how to care for them themselves if they have the disease, and also how to get the treatment and how to get well. Okay, and then lastly, obviously, is the treatment part of it in the set, this is where LSS ensures that people get a complete course of treatment, and they do this through checkups and follow-ups. Now, a complete course of treatment is very important so that the disease does not recur, it does not happen again. And obviously, through the education as well, these people are being educated on what to do to ensure that they don't contract the same disease in the future. So LSS is doing a really good job, and the other charities obviously that are in Mumbai. Then lastly, we have community work here as the third way in which LSS implements their objectives. And they have worked towards improving the nutritional level and especially that of children within the Mumbai slums. Now, we did say that most of these people are quite poor and the nutrition levels are not likely to be as good as they should. So the LSS comes in or steps in to ensure that children in these areas are getting a balanced diet so that they can live a healthier life. They work with the communities and teach them about sanitation, which is really important. We did talk about the fact that they use communal taps, and therefore there are water shortages. So the charity will help them to know how to use the water that they have to ensure that whatever is in the house is sanitized and is clean so that they do not contract diseases. So that's sanitation and hygiene, which is similar. And then also they provide some skills as well. So one of the skills, for example, is composting waste for sale. So they teach them how to take any like waste that they have at in their homes, so like food waste and so on, and they put it into compost heaps and tanks, so that they can then sell sell that compost for money. And in doing so, you are actually giving them a way of earning an income, so that they can get out of that poverty cycle. And then on top of that, other skills such as sewing are normally taught to the public as well, or to the people living in Mumbai, which again is a way of making money and will help them on the way out of poverty. The exam style question on this slide is from the 2022 exam paper. And it says to explain two advantages of bottom-up strategies in a named mega city in a developing or emerging country. And that's a 4-mark question. So that will require you to write down two advantages and then to explain each of those advantages. So if we look at the information that we have just discussed here, let's pick just one. So if we talk about health-related work that these charities are doing, so we could say that one advantage of bottom-up strategies in Mumbai, so we've named a mega city in Mumbai, is that they provide better healthcare to people living in the slums. So that is your point right there. Then explaining it. Now, for the explanation, we can say this will give poor people access to the medical attention or medical care that they need. That's your explanation right now, right there. Very simply, you already have 2 marks. Then we go on to the next point. So next advantage, because you need 2 advantages here. And if we go to the last one, let's go to this one. So community work. So what do they do with the community work? They are providing skills and trades. So we can say another advantage of bottom-up strategies in Mumbai is that they provide income-generating skills or trades to the people, such as sewing. So that there is your second advantage. Then to your explanation, this helps poorer people in the community to generate an income. There you go. So you've explained 2 advantages of bottom-up strategies, and the bottom-up strategy here we are using is the LSS healthcare case study. Okay, so that already will give you 4 marks for that question. So just make sure that you are practicing using information from case studies to answer exam questions, because the more you practice, the better you get, the more proficient or the better you get at answering the questions. Okay, let's move on to the next slide. What are the successes of LSS as of 2025? So the number of patients that have attended mobile clinics is 1.575 million people. Now, if we put that into context, the population of Dharavi is around 1 million people. So if you have had 1.575 million people attending these mobile clinics, then it means that you're having a big impact on the community, which is really, really great to see. And then in terms of the number of leprosy cases that have been identified, you have 30,259. But even better, 75% of those people that were identified as having leprosy have been cured. And that is a great number, which is really, really good. And then TB patients are being followed up. The number of them is 10,278. So that again is very, very positive, because it also not only, it not only gets people cured or healed, it also helps it helps with the disease not spreading within the community, and that is really, really important. All right, then the fourth one is that families followed in LDP is a number of families followed in the FDP program, and that's 15,161. Then the children in the educational program of LSS are 8,059 that have joined the program. So clearly LSS is having a very good impact on the Dharavi community or on the slum communities in India or Mumbai. So what challenges do they face? So we can only imagine what the challenges are likely to be. And two of them that put here, one of them is funding. Because they are a charity, they rely on donations, which means that if they don't get enough money from donations, then they are likely to be limited as to how much they can do within the community. So that's one challenge that they may face. And then another challenge is that, like we said previously, there's a stigma attached to having leprosy, and leprosy patients have to put up with a lot of prejudice in the society. Now, that may imply that people who may have leprosy may not be very willing to come forward for treatment because they have that stigma. There's that stigma that is attached to having leprosy, so they don't want to be embarrassed or ashamed, and therefore that could be seen as a challenge that LSS will face, because they have to go and try and get these people out into the open so that they can now get them treated. Okay, so moving on then to the exam question that we have here. This is an 8-mark question, and it says, for a named megacity, evaluate the extent to which a bottom-up development project has improved the lives of the residents. So you're evaluating the extent to which LSS has improved the lives of the residents. Now, you can use this information that we have discussed here. Obviously, there's a lot here to talk about. And then at the end, obviously, because you have 4 marks for displaying knowledge, so using this knowledge here or this information here, and then the rest of the 4 marks is for the evaluation part where you're going to be weighing up. You're then going to come up with a definitive judgment as to whether you think that LSS has improved the lives of residents of Mumbai to a large extent, or to a medium extent, or they have not improved the lives of people living in Mumbai at all. So that would be up to you to decide. But on the whole, this here is really good information that you could use in answering this particular 8-mark question. That brings us to the end of the LSS Charity Bottom-Up Development Case Study. I hope that you have found the information useful. The video on the Vision Mumbai top-down development case study will be linked in the description and will also be available on the case study playlist. It will provide information for the other side of the debate on bottom-up versus top-down development projects. Thank you for joining in this journey to excellent exam results. All the best and see you again soon. Bye-bye.